one of the very effective treatments for depression is ECT, electroconvulsive therapy. ECT actually was developed and first used in the late 1930s. There were two psychiatrists, Serletti and Bini, who conducted the first ECT actually in the back part of an arena in Italy in 1938, and the ECT actually went well, and it's been used ever since. ECT had some controversies, especially in the 1960s and 1970s, because it was used inappropriately with some people whose primary problem was not depression but something else, and so ECT acquired a little bit of a bad name, as popularized in the Cuckoo's Nest movie, which we're still living with the effects of. ECT actually is a very effective treatment. It has a high efficacy rate of probably about 90%. There are some issues with ECT. The big controversy has been memory impairment. In my experience, there is some memory impairment for ECT, and it is never, in one of the patients I've seen, has never prevented somebody from going back to their employment. They've always been able to get back to their place of employment. ECT does involve some disruption in the patient's life. Basically, for several weeks, a person is not able to work. And it involves treatment in a hospital, either outpatient basis or sometimes inpatient, for a series of treatments of 9 to 12 ECT treatments, and there is some expense because a hospital is involved, an anesthesiologist is involved, and a psychiatrist is involved. ECT is effective, and it's especially effective if there's a lot of push towards suicide involved with that patient. TMS is a nice new development because it's more user-friendly in the sense that it does not involve treatment in a hospital. It does have a fairly high efficacy rate, probably of 50, 60, or 70%. A person can have TMS while they're working. It does involve a drive and visit to the TMS clinic once a day, 5 days a week for several weeks. There's no changing clothes involved. There's no anesthesia involved. There's no unconsciousness involved. There's no needles involved. There's no significant pain involved. TMS is effective, and I've seen myself really multiple examples of people who got to where they could not work, and they were able to, after a course of TMS, they were able to get back on their jobs and with the enthusiasm for their job, which they previously had. There are some good things going in TMS too. The TMS is a technology. It's been out about 20 years. However, there are some exciting new developments. TMS recently acquired a indication for use with obsessive compulsive disorder. The main indication for TMS has been for depression. And I think over the next several years we're going to see some expansions in indications for TMS. Other uses such as anxiety disorder, bipolar disorder, and things like that. The nice thing about TMS is it's user-friendly. Insurance generally pays for it quite well nowadays.